Top 10 warmest years on record, all due to climate change.
Warm shopping season for Christmas in the U.S.
Australia has warmed about 1 degree since 1910.
2016, the hottest year on record, making it the third year in a row the record has been smashed.
Starting from 1880, this is the Earth's warming trend over a century, captured in a few seconds. We can see that most of the warming has occurred in the last 35 years. 2014, 15 and 16 were record-breaking years, each turning out to be hotter than ever. In the city of Ahmedabad, located in the hot and dry northwestern region of India, 2010 was one such blazing year. The temperature soared beyond 46 degrees centigrade and caught the people unaware.
There was no other clue. Our hospitals were flooded with number of patients, and we are just viewing that what is happening actually, and we are helpless. So as a municipal authority, we want to do something. Then the situation was pathetic.
In the infant ward of a government hospital, an unusually high number of newborns reported high fever and altered kidney functions.
We have two neonatal ward. One is on the ground floor and second is on the top floor. Most of the patients, almost 70 to 80% of the patients were from the top floor.
Many people had just no choice. Their jobs kept them out in the open. Some of them ended up paying with their lives. Just a year before the Ahmedabad incident, a group of experts from India and the United States had met in India to discuss the impacts of climate change on human health.
What we realized in that meeting is that there was very little research and work, and in fact knowledge done on the link between extreme heat and health.
A year later, the Ahmedabad heat wave triggered the curiosity of some of those scientists who were present at the Goa conference. They got down to studying the impact of extreme temperatures on the gross mortality in Ahmedabad.
We compared 2010 deaths with 2009 and 2011 and averaged it out. We saw that during the heat wave, instead of an average of 100 deaths, in that day, 21st of May 2010, 310 deaths were recorded just in the city of Ahmedabad. So that alerted us to the severity of mortality.
It was a wake-up call. In the month of May 2010, with no other evident cause, Ahmedabad had reported an excess of 1,344 deaths, a 43% increase in gross mortality. Something had to change. The task began from the Atlanta-based Georgia Tech University, where a team of meteorologists provided Ahmedabad with an extended 7-day forecast during the summer months. It meant the city government had adequate time to prepare itself for any crisis. To make this forecast usable for every citizen, a simple color-coded warning system was devised. It alerted everyone in the city about the expected intensity of heat in the next 7 days.
I have been in Ahmedabad where the posters have been in the city, and you see someone just reading in Gujarati, this is a heat day, here's what I need to do, and the red alert, orange and yellow in terms of what they need to follow. A very effective program to reach many people with sophisticated temperatures from IMD that reaches the people on the ground.
The city government appointed its health department as the lead agency to coordinate all municipal activities. A nodal officer was given charge of disseminating heat alerts to the local media, mobile companies, NGOs, and the State Disaster Management Authority, and further down to key line departments.
રવિવાર માટે રેડ એલર્ટ 45 ડિગ્રીને પાર જશે તાપમાન પડશે રેકોર્ડ બ્રેક ગરમી
Billboards, pamphlets, and public service messages through SMS, WhatsApp, and radio helped in reaching out to every vulnerable citizen.
આપણું જે મેઇન કામ છે એ મેઇનલી આઈસી રિલેટેડ છે અને પબ્લિકમાં અવેરનેસ ક્રિએટ કરવાનું છે.
A committed municipal corporation, eager to make a difference, geared up its medical officers ahead of the difficult months.
અને જ્યારે 45 થી જ્યારે ક્રોસ કરે છે ત્યારે મોર્ટાલિટી વધે છે. આખા પ્રોગ્રામનો હેતુ એ છે કે આપણે જ્યારે આપણને અલર્ટ મળે અને પબ્લિકને આપણે ડિસેમિનેટ કરીએ ઇન્ફોર્મેશન.
સાંભળો, તમારે એવું હોય કે ચલો તમારે ઘરની બહાર જવું છે, બરોબર? તો આ શેનું પેકેટ છે? આ ORS છે. ઠંડુ પાણી હોય એમાં નાખીને છોકરાને પાવી શકે.
Community health workers fanned out across slums and other vulnerable pockets, sensitizing people, especially women, on how to protect themselves from extreme heat.
आप जैसे आपके साथ ये छोटा बच्चा है ना, तो इसको गर्मी लगेगी तो इसके ऊपर आप इसके ऊपर है ना कपड़ा भी गीला करके आपको ढक देने का.
Last but not the least, the medical staff of local hospitals prepared to receive emergency patients of heat-related illnesses.
Our first diagnosis would be it's a heat stroke. So the main treatment we have to rehydrate the patient.
Here there is a deep depression due to which all the moistures are getting soaked by this depression.
2016, another scorching summer for Ahmedabad. The local Met officers were on the job.
We expect that the temperature is likely to reach the red range. We need to issue the red alert to the AMC.
Ahmedabad sizzled yet again. And at 48 degrees, it smashed a 100-year record. But there was a difference.
In 2016, when the actual heat wave came, we were very much prepared, our hospitals were prepared, and people were prepared as well. Actual number of deaths which happened, they are much less than in compared to 2010.
It's the first heat action plan that the city authority has developed, using the local data and analyzing locally and informing the local citizens. It's a first heat action plan which has gone from one city to many other cities in Maharashtra, such as Nagpur, in Bhubaneswar, in Odisha, and many other cities. And it has also set up a whole cycle by which the meteorological department can directly inform the citizens what will happen in next 2-3 days as far as heat wave is concerned. So it sets a precedent about informing the citizens and raising their risk awareness.
To know more about Ahmedabad Heat Action Plan, Visit www.cdkn.org.